Hello class, my name is Victoria and I am a juror on the case of the AU Bright Smiles Dental Clinic. I have carefully viewed over and over and listened to both sides of the case. After carefully reviewing all evidence, I found that I believe the doctor's office has violated the patient's confidentiality. I don't believe that the color codes of the patient should be at view for anyone to see because that is the patient's own personal information, and I feel like that is that violation of HIPAA laws because their information is being exposed by the color codes. Um, I believe that this information should only be seen by the hospital staff. The record should only have aids marked inside of the folders. If they're going to have color codes, to mark what different patients have, I feel like the information should be marked inside of the folders if they want to do the color codes, along with any other medical history. The only thing that should be on the outside of the patient's folder would be the first initial and first two initials of the first name and the first two initials of the last name, along with whatever the year that we're in. So if it's 2015, it should be a 2015 sticker on the outside, that or 2016 sticker. That way you know that the patient information has been updated from year to year. I believe the sticker should be put inside the folders as well, being that they know the patients. Being that they know that the patients are coming in for health reasons the following day, that all records should be pulled a day ahead of time. That way they don't have to worry about going to the back getting the patient's files. That way, because before you're seen by the doctor's office or dental office anyway, you're supposed to verify with insurance to make sure that the patient is still covered, knowing what their deductible would be that following day. So all the folders should be pulled prior to the visit. I agree that I agree with the plaintiff that they could have protected the patient information better. No one should know your health status except for the medical staff and yourself. When people see your health information, they start looking at you differently. And it could be something as simple as you can't help what you have. Whether it's you have AIDS, whether you have diabetes, whether you have cancer, you're already dealing with enough already, and to have others that are surrounding you see that you have a red sticker or some type of flag, and they start looking around, and that gives people reason to judge you, and you have enough going on in life and in the world rather than having the people in the medical office or dental office judge you by the color of your chart. So I agree with the plaintiff when she says that her health violation was violated. According to a HIPAA that I've read from that HS government site, it says protected health information. The privacy rule protects the individual identifiable health information held or transmitted by a covered entity or business associate in a form of media, whether electronic, paper, or the privacy rule calls this information protected health information, which is also PHI. Individual identifiable health information is information including demographic data that relates to the individual's past, present, or future physical or mental health or condition, the provision of health care for the individual, or the past, present, or future payment for the provision of the health care to the individual. So with the codes on the outside, as it has said in the HIPAA, that means that the codes on the outside of the file are showing that the patient was violated and her information was out to the rest of the individuals. Also in this HIPAA that I've read, it says, and the identities of the individual for which there is reasonable basis to believe it can be used to identify the individuality. Identifiable health information includes many common identifiers: name, address, birthday, and social security number. So no, none of the birthday or the address or social security number was not on the outside of the folder, but the violation of what that patient had with the red sticker was at fault and was giving out that particular patient information. So I'm siding with the plaintiff that her health information was violated, and I hope that she wins her trial. Thank you.